My name is Samson Olusegun Aturaka. The presentation is on assessment of effect of health worker strike on commodity logistic management in secondary and tertiary health institutions in Cross River State. The outline are introduction, statement of the problem, justification of the study methods, result, conclusion, recommendation, and references. Introduction. In a developing country like Nigeria, frequent labor crises leading to strike are common. The health sector is not an exception to this trend. A multidisciplinary sector comprising of many professionals like doctors, medical lab scientists, nurses, and pharmacists, to mention a few. Frequent strike by the health workers will affect the role and responsibilities of professionals in the health sector, especially in the laboratory and pharmacy department in the secondary and tertiary institutions. Research objectives. The goal of the study is to assess the effect of health worker strike on commodity logistic management in secondary and tertiary health institutions in Cross River State, Nigeria. The objective of the study are perspective. One, to assess pattern of health commodity logistic management during health worker strike. To assess knowledge and attitude of health facility staff in the laboratory and pharmacy section on management of health commodities during health worker strike. And three, to determine the effect of strike action in the hospital laboratory and pharmacy section in health commodity security and availability from the perspective of healthcare workers. Research questions. What are the common causes of strike in the health sector? Do healthcare workers have adequate knowledge of causes of strike and its implications to health commodity logistics? Does healthcare workers strike affect the pattern and process of normal commodities logistics as well as health commodity security and availability? 4. Could healthcare workers give relevant evidence-based recommendations to avert future strike and its effect on logistic management? Methodology. The study is a descriptive cross-sectional study of 192 respondents from pharmacy and laboratory departments in secondary and tertiary health institutions in Cross River State using semi-structured, semi-administered, closed and open-ended questionnaires that were divided into different sections each. Raw data were entered into Epidata and exported for analysis using SPSS software version 20. Level of statistical significance was P less or equal to 0.05. Results. A total of 192 questionnaires were printed and distributed to healthcare workers, and all were retrieved within the study period, giving a response rate of 100%. Table 2 showed the social demographic characteristics of study participants. About 88, that is 45.8% were male, 54.2 female. Participants had an age range of 18 to 55 years and an average age of 38.9 years, with standard deviation of 0.75. Moreover, 71.9% of 192 indicated their age were less than 45 years old. 62, that is 32.3%, were medical lab scientists, 21.9% were pharmacists, 20.8% were medical laboratory technicians, and 25% were pharmacy technicians. 140 graduates were either HND, that is 17.7%, BSc were 46.9%, MSc were 9.4%, and PhD holder were 2%. Majority of the respondents have been in service for about 1 to 10 years, that is 60.4%. Out of which pharmacists are having 12.8%, medical lab scientists 20.2%, pharmacy technician 17%, and medical lab technician 8.5%. Results. Continue. Table 6 below assess the causes of behavior of facility staff during strike action. Unresolved negotiation and disagreement in the behavior of health workers strike and their association and employers and their representative were cited as the most common as well as the most important causes of health worker strike in Nigeria, with significant association of p-value of 0.3%, 0.03, and p-value of 0.001 with all the professionals and year of service used. Other common causes were failure of government to honor collective bargaining agreement to improve wages and condition of service, showing significant degree of association, that is p-value of 0.001 within the age group. There is a significant association of p-value of 0.001, 0.002, and 0.001 among professionals, year of service, and educational qualification with disempowered doctors and healthcare workers who feel unable to provide the best possible care for their patients because of inadequate facilities, drugs, and lack of support by employers, especially elected government officials. While less than half of respondents agree that strike action are caused majorly because of superiority complex among health workers, showing significant association of p-value of 0.002 and 0.001 within professional and year of service. Here are the table showing the T-square table of association. Results continue. As the table 6 shows the effect of strike on earth commodity management, there is a significant association of p-value of 0.004, 0.002, and 0.001 among professionals within the age group and year of service in agreement with respondents. 82.3% that frequent strike has effect on earth commodity management. Also, there is significant association of p-value of 0.001, 0.001 among professionals and year of service in relation to the agreement that strike action contributed to damage and expire commodities in the facility. While p-value of 0.01 shows significant association that cold chain products and laboratory equipment are also responsible for expired and damaged commodities during strike action. This is a significant association. There is also significant association of p-value of 0.001 within the age group, year of service, and educational qualification of respondents that strike action have effect on revenue from drug revolving fund, pharmacy services, and laboratory services department, thus reducing economic inflow of the facility as shown in table 6 and 7. Results continue. Figure 1 below shows suggested solutions made by the participants that can reduce or eradicate strike. The respondent cited prompt payment of salary arrears and allowances, that is about 20%, avoid unnecessary deduction from worker salary, keeping to agreement reached with workers, implement resolution from dispute agreement quickly, health workers should be adequately remunerated, and salary increase, promotion of staff as at when due. Welfare of workers 6.4%, good working condition and good condition of service are also crucial. That is the figure 1 showing there. In the study, unresolved negotiation and disagreement of health workers and employers are the most causes of strike action. This is in contrast to Adebimpe et al. And Obinna et al. 2016 that have demand for better salary and welfare of workers, and healthcare leadership and management issue as the most common. Other causes focus on failure of government to honor collective bargaining agreements for improved wages and condition of service, and disempower doctors and healthcare workers who feel unable to provide the best possible care for their patients because of inadequate facilities, drugs, and lack of support by employer, especially elected government officials. Recommendations: multi-month prescribing model of dispensing of drugs should be adopted when there is impending strike action in all health facilities, especially for patients on antiretroviral drugs and opportunistic infections, tuberculosis, diabetes, hypertensive cases, and other chronic diseases. Recommendations for employer, government. Among the recommendations made by the respondent for government to prevent frequent strike action in health care institutions are prompt payment of salaries, salary arrears and allowances. Avoid unnecessary disruption from worker salaries, keep it to agreement reached and workers keep it to agreements reached with workers, implement resolution from dispute agreement quickly. Health workers should be adequately remunerated. Salary increase, promotion of staff as at when due, prompt attention to welfare of workers, good condition of service and availability of working tools, equipment and commodities. Others are government should prevent healthcare workers to go on strike. Skeletal services with pay should be allowed for lab and pharmacy staff and good infrastructure in place like constant power supply and maintenance of cold chain. Recommendation continues. Standard operating procedure of policy documents for management of health commodities during strike or implementing strike should be put in place by government. Healthcare workers, especially facility staff in both laboratory and pharmacy sections, need to demonstrate favorable attitude towards a looming strike by making sure that there is commodity security and availability of stock, no expired or damaged commodity, and there should be access to health commodities, including laboratory services during strike. Keeping to 6+1 logistic rights and putting good infrastructure facilities in place, especially storage facilities, that will ensure that cold and cold chain products are maintained optimally will ensure commodity security, availability, and enhance customer satisfaction in all our facilities. Conclusions. In line with Adebipe 2000 conclusion, it can be deduced that health workers' strike have have more adverse um, have more adverse than positive effects, and can be concluded that frequent health workers strike has serious effects on health commodity management in secondary and tertiary health institutions in Cross River State. However, healthcare workers, especially facility staff in both laboratory and pharmacy sections, need to demonstrate favorable attitudes towards a looming strike by making sure that there is commodity security and availability of stock, no expired and damaged commodity, and that is access to health commodity, including laboratory services during strike. Adopt multi-month prescribing for a policy for managing strike in the country. Keeping to 6+1 logistic price and putting good infrastructure facilities in place, especially storage facilities, that will ensure that cold and cold chain products are maintained. Ultimately, will ensure commodity security and availability and enhance customer satisfaction in all our facilities. Thank you very much.